Okay, hello everybody. Let us start. Welcome to our panel and book launch, Social Work and Health in Prisons, studies from Central Asia and from China. Oh, no, it doesn't move. Okay, so let us start. So this is a book presentation together with our colleagues from different countries, from China, Kazakhstan, Uzbekistan, Kyrgyzstan, and from Germany. We compiled this edited volume. It's on social work services and health services in the prison system. And in itself, it's the first in-depth study on the prison system. As you know, this is a rather closed field. And we are very happy to present this book today and would like to discuss it with you. So we have these questions for the discussion. And these are questions that we covered in the book. So we were looking at prison reform in Central Asia and China, what progress has been made, what challenges remain. Of course, we know that it's a very difficult field to work in, and it's very interesting to see where we are in the different countries. Then, of course, we're interested in the global framework. We wanted to understand how the different countries are working with the international prison standards and how UN agencies are working in this region. So what work has been done and how it is, and how, for example, are local actors involved, non-governmental organizations, but also state agencies at the local level. Then we are interested in best practices. So what are interesting examples from this field that can be also transferred to other country contexts? So we want to understand what kind of programs have been developed and also what are the best practices in this field. For this, today we would like to present you our book and invite you to a discussion. Our panel participants are the following: Dinara Yasimova, the coordinator of the SOLID project in Kazakhstan; Ingo Ilya Michels, the SOLID International Scientific Coordinator; Heino Stöver, the SOLID project leader; Hang Su, a postdoc in our project in China; Maria Prilutskaya, the postdoc researcher for Kazakhstan; Jakin Shadimanova, our postdoc researcher in Kyrgyzstan. And then we would like to discuss with you with two external persons, and we are very happy to welcome here Aida Shekerberkizi, the Inspector of Educational Social Work of the Penitentiary Services of the Republic of Kyrgyzstan. And we would like to welcome also Natalia Shumskaya of the AIDS Foundation East-West in Kyrgyzstan. Please say hello to our panelists. We have now five short presentations, 5 input presentations. And after this presentation, we would like to discuss the questions with you. Thank you. Now I would like to introduce Dr. Michels. Please come here.
No presentation. So I have been asked to speak 5 minutes and to talk about the standards, the international standards. The people of UN worked on these standards several years, so it will be a challenge to be ready in 5 minutes, but do my best. Searching the presentation. Anyway. Well, concerning these international standards, these standards are organized and developed by the Agency of United Nations, and that means that all the member states of the United Nations should follow them. It's not binding, these standards, but at least good, how to say, recommendations for practice. And now, no, I don't know.
Second slide, please.
Yes. Well, looking, as I already said, these standards are not binding for the member states, but should be, how to say, the basic of the standardization of the rules. Next, please. And this is the.
Next slide.
Yeah, these are the most important. The so-called standard minimum rules for the treatment of prisoners. Now they called Nelson Mandela rules because, how to say, to remember Nelson Mandela, who had really good prison experiences, long, not good, a long prison experience. That's why these rules are called after him. And the most important sentence is this one. All prisoners shall be treated with the respect due to their inherent dignity and value as human beings. No prisoner shall be subject to, and all prisoners shall be protected from torture and other cruel, inhumane, and degrading treatment or punishment for which no circumstances, whatever may be invoked as a justification. The safety and the security of prisoners, staff, service providers, and visitors shall be ensured at all times. This is the most important sentence. We came back later on. What is reality? But this is the most important rule, I guess, for all the prisons and prisoners. And after several years later, then these rules had been focused on the situation of women in prison. Now, at first, they had been neglected because the number of women prisoners are much smaller than of male prisoners. Anyway, they need special services and support, especially also women who are pregnant, for example. And here in Kyrgyzstan, we have been working in the Central Asian Drug Action Program, the CARAB program. We supported the development of both treatment centers in the prison system for drug users in the male prison, the so-called clean zone, how to say, prison in the prison, to help people to get out of the circle. And I think 2 years ago or something like that, or 3, in the women prison, also here in Kyrgyzstan, and with the idea that they will also start with methadone treatment in the women prison. And I hope that it is still working. We will discuss with our Kyrgyz colleagues on this. But in this prison, as far as I know, these standards and rules are really supported and accepted. And there are some other rules for prisoners and for prisoner non-governmental actors. This is also very important. The non-governmental actors shall be involved in supporting both the prisoners and the prison authorities and the society. And later on, we will talk about, because here, especially in Kyrgyzstan, many NGOs are working in this field, and it's very, very helpful to have them on board. I think Natasha Shumskaya will later on talk about this. When I was here, it was really tremendous experience for the first time to see all these NGOs working in this field and helping so much the people who don't have any support, other from relatives, of course. For example, when I have been in Tajikistan, 5 minutes, okay, 2. So in Tajikistan, in the prison in the center of the city of Dushanbe, I was wondering in the morning, a long queue of people standing there bringing food into the prison. I said, what is going on there? The relatives had to bring them food because the prison system was not able to feed all the prisoners. That was for me, at least from the German prison system, really push. Well, one of the biggest problems, overcrowding, at least all over the world. And we have to acknowledge that a quarter of the inmates are in this prison because of possession of drugs, or how to say, trafficking little small quantities of drugs. And overcrowding of prison is one of the biggest problems. In Central Asian countries, we have learned that the overcrowding has been reduced in the last years for several reasons we can discuss. And the other issue is prison mental health, already mentioned, and health situation in the prison system. Here is a brochure organized by the not European Commission, European Council, Pompidou Group, and this guy is working with the Pompidou Group for many, many years now. He will tell about this later on, I guess. And this brochure had been also, I think, translated to Russian. And so you can find it on the website, okay, as well. All of these documents will find on the website of UN. And this is very important. I know you will later on talk a little bit more on this, but prison health is a very important issue, also in German prisons. Yeah, and this Istanbul Protocol is the last slide of, may I always last slide? This is, yeah. You can also have access to this. Last but not least, the international standards of treatment of drug use disorders. These are treatment standards organized by UNODC and WHO, which are used to how to have standards for the treatment of drug use disorders. And we have done in Karab many trainings with our partners and colleagues to help these, to understand these treatment standards and to work to use them. I think, and they are used, especially here in the region. How? I guess so. So that's it for introduction. And yeah, this is the comprehensive treatment system, which should be available for prisoners, also for prisoners, but at least in the community. And when the prisoners get out of the community, they should have access to this comprehensive services. Ideal. Well, yeah, and this is the picture from a prisoner drug user in a rehab center in Tajikistan, who tried to, how to say, to give an idea of his hopes after coming out of this circle and the prison. So, спасибо ваше внимание.
Thank you, Ingo Ilya. And now, please welcome Dinara Yesimova, our researcher from Kazakhstan.
Okay, thank you. First of all, thank you very much for such a pleasure to be here and invited by our Solid project, which we worked today here and yesterday finished our work by Solid project. And I'm glad to be here and thank you very much. And the topic was the first line, my topic. Okay. This is outline because the topic it was significance of national preventive mechanism in development, social work and health care in prison, case study Kazakhstan. And because I'm running also as a head of National Alliance of Social Workers, but here also I'm presenter now like a member of National Preventive Mechanism, and I'm running with this activity last 3 years. And here we are trying to advocate or provide a little bit information about our chapter, which we glad to have in this monography. And it's also a step to advocate on the, how to say, high level this book, because it's very few or rarely in our region when the book calls social work in prison. And outline the next slide. Yeah, I will try. No. What is NPM? Because here in audience, not everyone is social worker, and here it's our photos from yesterday. And the next, yeah, and I put some questions: why NPM? What is NPM? How it acts? Because it's in Kazakhstan there are several visits, for example, on time, periodical, inheritum, and topical visits. And the last one point: what is the case? Case that we are mostly is dealing with cases where someone talking that torture probably happens, but then we are going as an on-time visit. But from my point of view, a social worker and researcher in this field, it's not enough to deal with cases, but much more important to use social work technologies and values and principles, and to probably to turn social workers as an agent and driver of positive developments. Why? Because since last year, we have 5 social workers in our NPM team, because whole team in 135 members. And I and my colleague Janar from Almaty, we start to be the first social workers in NPM in Kazakhstan. This is also why we are working on this monography, because we start to raise some very important questions. Next slide, please. Next slide. And yeah, it's again next slide. Because how I said before, the audience, not everyone social workers, we put the definition, global definition. Please, next slide. Global definition, what is social work? This is slide on Russia you could follow, and the next one on English, because social work, it's profession who is not running just with social services, but because it's profession in dealing with human rights and empowerment and advocacy. And also with article approach, how to probably make people and human being more free. Next slide, please. And next slide. And here, I hope it will be my last point. As a book, it's now it's show us probably to chance to lift up social work, and especially education and social work, because as I put here, prison, it was separate discourse, and social work was again separate discourse too, and we want to get them like to provide a bridge much. And probably it would be first attempt to start joint professional discourse in Central Asia, in our countries. Why? Because in light of that, we have a lack of army qualified enough social workers as a general practitioners of social work. And probably, but there is no time to wait. With such a big army, for example, like in Germany, they have 20,000 social workers from bachelor every year. In Kazakhstan, it's just 300 social workers finish it each year university. But prevention of violence, they couldn't wait such a big army, and we start to do something and probably raise a question and try to negotiate with our government and provide trainings for, like today colleague said, not just for social worker or human or prison staff, but also from policy, from different departments, from policy and another, who could identify and help to work to probably, yeah, to that for human being to enhance, how to say, advocate them and provide empowerment to prevent people to put in prison, because the observation shows that people several times go into prison, and it means that it's a lack of prophylactical work, etc. And quite a background information from where we began to work with that, and NPM, it works last 8 years. Next slide, please. I have no time. And here, yes, who is a member on PM? And today I mentioned that we have a rising number of social workers in PM team because it rise from the, for example, at 1% to until 9% now. It's nice because it's mostly was lawyers, but their potential not enough probably to observe violence in social services organization. Next slide, please. And for why social workers actors in PM prison, because here it's mentioned things with such things, and we try to cover, for example, identify violence, child neglect, homeless, and compulsory treatment, and condition of people in prison, and special services, and for example, law of rights of children in orphan house, and etc. And this is here mentioned in our social code, at least now. And since Kazakhstan adopted social code recently in current April, and it's also the social code involving individual helper in prison, which are going to help to 50 disabled people who is prisoners. And it would be a nice step because we're trying to provide for them training, special trainings, how to work and to be, how to say, like parasocial work in prison. Next slide, please. Yes, thank you for attention. If you have questions, will be great. And there is some questions raised here, what UN agencies did in the region. I have several examples of what did, for example, UNDC, UNICEF in Kazakhstan, and I could quite later answer to that. Thank you very much. I'm happy to be here.
Thank you very much, Dinara. And now I would like to ask Hang Soo to come.
Thank you very much for the solid project and the city health conference for inviting us to attend this meeting. I will introduce our social work and health in prison in China briefly. So next slide. Thank you.
Next slide.
Oh, sorry. Okay. In China, our prison system and the compulsory drug rehabilitation system is a little different. Because our drug users in China, our drug users were often sent to the compulsory drug rehabilitation centers instead of prison, unless if the users has committed some crimes and, for example, they sold the drugs to others or they transfer the drugs to our country, they will send it to the prison. So our survey about the drug users in China, we often conduct our research in this compulsory drug rehabilitation centers. The prison system and the rehabilitation system is similar. The prison system has been around 4,000 years in China, and the People's Republic of China's prison law is the main law in China. So there's a lot of type of prisons in China according to the characteristics of the drug user. For example, the male, the female, or young. So next slide. Okay. Okay. The population, according to our survey, by the year of 2021, there were about 1.5 million drug users in China, and it's about 121,000 new drug users in China. But according to our survey, we found that in the past 5 years, we found that the drug users in China has decreased. The social and health issues in these drug users is about these several aspects. The drug users in China, they often know little about our law, so they will increase the management resistance, and their safety in the drug rehabilitation center is often influenced by others, for example, the violence, and they are often have a lot of problems, physical disease and mental health disease. So okay, I will shortly I will be faster. Okay, the social worker in prison system, there is a lot of things we need to do. For the first thing is the medical service. I think for the drug user in rehabilitation center, the medical problem is the first problem for them. We are building a lot of hospitals in the rehabilitation centers, and I think they should accept they should receive a medical treatment and reduce their drug dependence and promote their physical and mental rehabilitation. So the second one is the education system. I think, according to our survey, we have built a lot of education program in drug rehabilitation centers. For example, to correct their cognitive basis, development confidence, acquire knowledge and about drug rehabilitation, and receive training in employment and improve their confidence in society. The second one is the family support. The family environment is very important to our drug users. Our social workers is often help them to communicate with their family members, and by a lot of means, for example, the remote video meetings, phone calls, and mails, and other instruments. So the NGO in prison social worker, our city, Shanghai, in Shanghai, we have a lot of good experience. For example, the self-raising service society 4S system was founded in Shanghai in 2003. It was the first non-profit in the field of drug recovery. So the main work, this system provide a lot of methods to improve the right of the social of the drug users. For example, the early intervention, community drug rehabilitation, and peer support counseling, psychological counseling, and a lot of other things. Yeah. So what are the barriers for the social worker in prison or in a drug rehabilitation center in China? Firstly, the social worker in this place is far from perfect. And secondly, the social organization and the drug treatment centers have limited cooperation projects. And the third one is social worker intervention in drug treatment will be difficult because we have a lot of barriers in doing our research. Okay. And the last one is the social workers are lack in China. We, according to our survey, one social worker has to communicate with 20 drug users average. So this is my last page. How can this challenge be addressed? I think education should be supported for both for the drug users and for the social workers. For the social workers, we need to train them to how to deal with the problem with the drug users in physical problem and in mental health problem. And we need to employ more social workers and furthermore, the prison system and the community department should communicate with and cooperate with each other. So our conclusion is that social work in China prison system now is still a relative preliminary stage. We have a lot of work to do. For example, the medical care, education, vocational training, psychological counseling, and social support. So one last word is we are doing, according to our so solid project, we are also doing some research and program to improve the social workers' ability and use some new technology, for example, the artificial intelligence to improve our social workers' ability and the drug users' ability to quit the drug and have go back to the society. So this is my presentation. Thank you very much for listening. Thank you.
Thank you, Hansu. And now we move again to Kazakhstan. Maria Plilutskaya will present what she has written in our book.
Okay. So could I switch to Russian? Yes, okay. Сейчас, пока загрузят презентацию, я бы хотела еще раз отметить большое значение той книги, которую мы совместно делали в течение, наверное, год, и активное написание. И те сложности, которые возникли при написании, это, конечно же, все те барьеры, которые мы имеем на сегодняшний день в развитии, и, как говорили мои коллеги.
These are the barriers that we face in our efforts to provide social support to our clients in the penitentiary system. The young Canadian philosopher said, "You are not free the day you walk out of prison, you are free the day you walk out of ignorance." Of course, this is directly relevant for the drug dependence, but also this is important for the physicians who are involved into the delivery of this support and care for prisoners, and particularly in Kazakhstan. And I shall explain it to you soon, but first, please check out the statistics on prison population in Kazakhstan, and you can see that there is a fluctuation line with indicators changing. In general, it doesn't go down. Well, it goes down eventually, but recently going up. And it is to a certain extent determined by the COVID pandemic, and the penitentiary system is particularly vulnerable in face of the COVID pandemic. Speaking briefly about the regulatory framework, of course, this is a penal code, health code, which is a pride, the product of our pride, because it provides all regulatory provisions. It is well centralized, well designed, and also it has a component on this care to be provided to the patients with dependence. And there are orders of the Ministry of Internal Affairs and also orders of the Ministry of Health still pending, because the decree on the transformation and handover of the authorities to ensure the access to healthcare services, it was handed over to the Ministry of Health, and this is a big breakthrough, but also this is a tremendous challenge for the public health as well, when our main specialists have been assigned with a wide range of the issues to be addressed in the fast-track mode, with the equality principles to be introduced and ensured, or at least to reduce the gap. Speaking about the statistics, and we can see that this data was provided by the specialists.
Одна главная проблема для меня, например, как для исследователя, это видеть прозрачные цифры,
Нам не слышно, не
возможность
слышно.
регулировать, возможность видеть, что за этим
So we need to see what those trends hide behind. And we couldn't get this data in the open access, and therefore we would like to thank the medical service which provided us with an access, and the specialist became the co-author of this article. Yes, we can see that there is an official statistics which registers the cases, but there are also some narcology specialists working within the penitentiary system who should be providing such support. However, we can see that this problem exists both in case with HIV infection and with, in terms of that reports don't cover this subject of the low coverage within the penitentiary system, and one of the postdocs mentioned that at least 57% reported drug use in prisons. And as to the health delivery system, the general narcology system has multiple levels. We do screening of the risks. It is integrated with the PHC. But within the penitentiary system, this is a big problem when it comes to integration. There are some episodic screening, and there is a compulsory treatment program, and it includes only some of the interventions. This is some tracking of the person if the person stays sober, and then the referral to the narcology service of the public health care system. And in Kazakhstan, we have already conducted certain projects such as Clean Zone by Atlantis model. And also this is a project to promote interaction between the mental health center and the narcology center, and also that was an effort to introduce multiple level rehabilitation. And you can see that in 2012 the project was proposed with detox and then with rehabilitation and social integration as a third stage. What was mentioned before, that we need the permanent staff to make it the system-based approach so that we can accept some consistent results at the end. And in my conclusions, I would like to thank the whole team because the product there was a result of teamwork, and to thank Solid Project for this opportunity to have discussions. Thank you.
Now I would like to welcome Aida Shekerbekizi, Inspector of Educational Social Work in the Kyrgyz penitentiary system. Aida, thank you.
Добрый день, уважаемые.
Good day, dear participants of the conference. I would like to thank on behalf of the management, the organizers of this conference, for giving us an opportunity to take part. And I'm confident that this conference will serve as the next driving force to continue with the improvement of the penal enforcement system. So the main work of the social work within the penitentiary system is to create conditions for the resocialization of the prisoners and to support their successful reintegration after they get released. In my presentation, I would like to highlight such problematic questions in the Kyrgyz Republic as the necessity to build an efficient system of resocialization and reintegration of prisoners. As the analysis has shown, the main factors which frame the efficiency of these procedures is to improve the living conditions of the prisoners, first of all, the social and healthcare services, legal protection, increasing the educational level and training, and to do the training to improve their skills, and to support with the employment of both within the prisons and outside after the release. Currently, the agenda of the increasing of efficiency of the penal enforcement system, the public administration bodies are undertaking strategic decisions to reform the penal enforcement system, and also actively they are constructing the objects, the infrastructure objects, for example, housing and utilities services, cultural, recreational, and health-related infrastructure. And also the services should be upgraded to be in compliance with the international standards. If you ask me about the specific statistics on social work, specifically when it comes to the social welfare for prisoners, I can say that for today, the penal enforcement system since 2023, so for today we have 155 pensioners in the prison system, and 29 of them are entitled to pensions, and 126 get subsidies. There are also people with special needs, 42 people with special needs in prisons. 4 of them have the first category of a disability, 27 of them have the second degree of disability, and 24 have the third group of disability. And 18 prisoners out of the people with special needs get the pension payments, and 24 prisoners who have special needs don't get the pension payments because they need to be re-examined and to be issued with a certificate on their social and health conditions. As to the employment opportunities for prisoners, I would like to inform you that the number of the workable people within the prison is 4,517 prisoners, and the number of the factually employed is 1,098. Also, we like to note that the education is not only the way to increase the workability and the skills of the prisoners, but also it is important to develop their personality, because if there is no employment opportunities, there are high risks of committing the repeated crimes. 11 convicts are taking the primary education classes, so we have educational activities provided in the prison 27 and the prison number 3. This is for those convicts who need the primary education level. As to this general education, there are 27 convicts who are taking the general education classes, and in 12 prisons, this is the prison 1, 2, 3, 8, 10, 14, 16, 33, 32, 51. There are vocational schools opened where they have faculties for 24 specialties, such as welding, electricity engineer, shoe engineer, the tire production, wood craftsmanship, plastering specialist, and also the leather works and also IT repairs and traditional craftsmanship and the repair specialists for fridges. For today, about 1,037 convicts who are taking vocational training. And as to the issuance of IDs and passports, from 2020 till 2022, more than 1,280 convicts have been issued with IDs. In 2023, 61 passports have been already issued. So for today, there are more people who need IDs to be issued with, and the number is 247, and those who denied to be issued, that was 365, and the reasons are the following: because they don't have the full set of the required documents, and for example, they don't want to be registered with a place of residence as a prison if they didn't have another place of residence registered before. And the regulations of the government set the deadline for the passport to be issued. This is 2 days. They have 2 days deadline to pay the fees for the passport to be issued. And if they fail or don't have an ability to pay, then the deadline is over and they're left without IDs, which means they cannot be entitled to pensions or subsidies. And the financial support is being provided, and 24 convicts have been provided in 2023 with some food packages and monetary some subsidies in the amount of 500 soms per one prisoner. Few words about the healthcare services. At the health and prevention centers of a penitentiary system, they have procedural rooms operating where they can talk to prisoners to convince to take the treatment and to follow the regimen. And also healthcare staff works with convicts to implement rehabilitation program for HIV, and for the convicts with drug and alcohol use, they offer MIT services, and also we can provide rehabilitation services. So we have rehabilitation centers, clean zones under the Atlantis model organized as well. Since 2023, we have registered 45 cases of illicit drug trafficking and 7 kilograms 885 grams seized, and also that was the seizure of alcohol drinks. There were 22 cases of such seizures. So once again, I would like to express the gratitude to the organizers, and we believe that such exchange of experience will support the further development of the partnership.
Natalia Shumskaya of the organization AIDS Foundation East West.
Добрый день. У меня нет
Good afternoon. I don't have a presentation. I was requested to share my experience, the studies and researches, along with interventions. Yulia Rozanova has presented the key findings of this project, and I would like to focus on the approaches as part of our interventions. the peer-driven interventions. The idea and the concept itself, when we had the meeting at first, we were discussing the possibility of such a survey or research. And since 2005, we are working in prisons on HIV prevention. And we provide information about HIV, how it is transmitted, how to get protected. And sometimes it is interesting and fun, and sometimes it's not fun because they are not accepting this as relevant information for them, because if they don't have HIV, they believe they will never come across this situation in their life. And therefore, I was discussing with Julia about some interventions, information communication intervention. This must be personalized and customized to prisoners, and to approach the concept of the health from the lenses of person-centered approach. And we have checked with people who are serving sentences in prisons what is more attractive and important for them in terms of their health. And together with peer navigators who had some experience serving sentences in prisons in the places of incarceration, and now they are engaging in different preventive programs. And together with them, we have developed a module consisting of 12 topics. We started it in a very interesting way. What is the unique nature of myself, unique feature of myself? What is my benefit? What is the healthy body? What is the healthy lifestyle? And these are simple existential questions. We have tested this in the hostel for people who are under transit when they were released from prison, and they had no housing, with the help of different donor-led organizations which provide this kind of shelters. Drop-in centers, shelters. What topics can be addressed, and how to convey these messages. We have tested them at this hostel. These are the target audience should become our co-authors, maybe us becoming their co-authors of the topics of their concern, and together with the peer navigators or peer-driven intervention. When we came to the penal service, penal enforcement state service, and Aida mentioned about different programs available at the penal enforcement state service. I would like to extend my gratitude and thanks to this penal enforcement state service. And in the past they were under different ministers. Now they under the Minister of Justice. They recognize the problems of people with different addictions in prisons. If you can do something, if you can tackle these issues, why not you implement these programs which will help us to reduce risks for people with addictions. And this openness enabled us to implement this kind of interventions and into experimental groups and control groups. And we are happy to obtain these good findings and results. Our participants were very keen to meet with us once a week. We had this kind of meetings. They were requesting 2 times a week, and they were fulfilling their homeworks. And this kind of engagement is quite amazing. And the general topic was addiction, and the overriding topic was the addiction which was a part of all sessions. And we had our research objective through which intervention we can launch the process of reflection and dispel certain myths which are common in custodial institutions, harm reduction programs, and also methadone substitution therapy and the Atlantis program. This is a paradoxical. They deny the addiction as a disease. And if you look at the hierarchy, those clients which were part of the methadone substitution therapy, which belong to the hierarchy of the prison subculture, they belong to the lowest subcaste of the prison hierarchy. And the possible discussion platforms which we created during our trainings, which helped us to discuss many issues, and we listened to them very carefully, what is preventing them from joining the programs, which really and substantially reduce the harm and transmission of different infections, and including HIV. And it's a pity I didn't have much time, but this training module is tested, and we are happy to share this with the state penal enforcement service. And I have met Barzhan, very motivated person. This is a great advantage that they have social workers, psychologists, and with the involvement of many partners and counterparts, their capacity will be built up, and this kind of modules will be on a consistent systemic basis. And we would like this training module to have this among the methodological guidelines and guidebooks to make a difference for people serving sentence in prisons. Thank you.
Thank you, Natalia, for this really inspiring example. So before opening the floor for questions from the audience, I would like to make a small announcement. Some people of you might think that we have a coffee break right now. This session will go until 4:30. Then we will have the next, the ceremony, the next point of our program. And then after that, we will have a dinner, a buffet for everyone. So this is how our program will go further. But now, let me open the floor for questions from your side.
Good afternoon. Natalia Shrumskaya has introduced myself. Let me introduce myself to the participants of this conference of Barzhan Kazımbayev. I represent the psychology service. I represent the state penal enforcement service. Currently, since 2003, the management of our service, penal service, is undertaking some drastic measures or actions to change the system of providing social and psychological support to our prisoners, incarcerated prisoners, and we conduct the in-depth analysis. And secondly, we implement some routine activities, and we are in the process of reorganizing our service. I don't know what is the experience in other Asian countries. We are expanding the staff of social workers, and we have expanded the staff of psychologists. And currently, we are at the phase of relaunching all these services. And once again, let me assure you and reassure you that we are happy and prepared to become the platform for people to provide services for resocialization, reintegration, and rehabilitation. Today, I introduce myself, Alexander Zilichenko, Central Asian Center of Drug Policy. I have a question to our representatives from State Penal Service and Natalia Adilovna in Kyrgyzstan. We have very unique experience in women prison clean zone. In 2005, 2006, we have spent lots of resources, lots of funds, and finally we have this clean zone in place. And we had huge expectations. And this clean zone demonstrates different approaches of different countries to dealing with drug addicts in prisons. This is an awful example, but when we constructed this clean zone, we have spent so much money. And I was against this, that in terms of drug policy, our countries are completely different, and it is not reasonable to invite the representatives from other countries, and they may see some hidden agenda or something. And this was exactly the case after we have shown everything, when we have guided them through, and we had meetings with the prisoners. These are the women prisoners, and several women, our colleagues, approached us. I will not specify the name of the country. What was the reason behind this? What was the purpose? Was it worthwhile doing this? Maybe we were supposed to get done with them once and for all, and it was difficult to explain them because we are at different phases of insights and understanding these issues. This is just an example. And today, currently, from civil society and state penal enforcement service, what is the coefficient of efficiency of this clean zone in prison? Are there any psychologists available? Whether they are well prepared, well trained? This is a unique product. We don't want to lose this initiative, this and development, and we will feel ashamed in the front of the world, in front of the world.
It's my second time I'm here. Okay, because this is a question for our service. I can speak on the clean zone. We have it operational not only in female prisons, but also in other prisons. To your simple question, I will give simple answer. Do we need this? Yes, of course, we do need this, because resocialization is based on rehabilitation. As to the HR training, yes, I agree with you, and that's why our senior management is taking actions to increase the capacity, to do the capacity building, and Eric Sadikovich has invited me to this event, and I'm thankful for this. And we had the faculty staff members of other universities visiting us, and we suggested that the penal enforcement system should serve as a platform for our partnership and to improve HR supplies. The diploma itself will not give any guarantee that the specialist is well trained and committed. That's why right now we are doing the analytical work and we develop the development strategy for the next years, and it will be closely interconnected with the social workers, with the government and non-governmental sector. And the idea of our management is that the psychological and rehabilitation service is based on the psychological and social science. This is a priority for myself as I can see it. I also would like to make an additional comment to reply to your question. Atlantis and Clean Zone programs are operational in 8 prisons. So those prisoners who are covered by this program, as of 2023, we have 128 consultancies were provided to the PVD prisoners. And based on those consultancies, the prisoners made some shift of paradigm, let's say, some shift in values. And yes, it is sensible to have this program because we are already having the results for 2023, and the main objective this is to do rehabilitation of prisoners. PhD in medical science, Tolebek. I represent the Association of PHC facilities in Kazakhstan. Right now we are having a difficult situation with the handover of the medical service to the PHC level. And there is a full resistance to accept this handover, and it's like now we have broken SOPs, and of course I do support the humanization, but just to do this mere, handover of the released, prisoners to the general PHC level, we believe is too early. There is no acceptance at the side of the receiving party. So what kind of suggestions you can share with us? Thank you for the question. Well, in fact, what you've just described, this is considered to be the progressive practice because it expands the opportunities of the prisoners. Because when we visit prisons, usually we see the nurse, it's like in-house nurse, and also there is a civil nurse from the civil sector, and also psychologists, the same split, yeah, in-house psychologists and civil psychologists. And there are many vacant posts for these positions on both sides, in fact. And so this is in fact a progressive breakthrough, and maybe not all countries are ready to make such shift because this is a matter of the political will, but this is a transformation which requires some time. Recently, when visited prisons with isolation regime, they told us that it's not easy at all to fill in the vacant positions, but in November 2022, the consolidated report, the Minister Dudnik made the presentation. And when we visit the prisons, we have medical logbooks to register the cases, yeah, what was the reasons for the emergency call. So if there were any cases resulting from the cruel treatment, then it means that this will become known faster, and it's an easy track to report about such abuse cases and violence cases. And with Istanbul Protocol, it's even easier to promote the human rights in prisons. I told you that I support humanization approach. And as Maria said, when we were developing this monography, so Janara, the head of the health unit in the penitentiary system, she was the co-author as well. And we have conducted a big forum, which was named a social work with prisoners. And now you can see that our colleagues in Kyrgyzstan also have very progressive approach. So on the civil side, they have social workers, and in our case, this is under the Ministry of Interior, and that's why we cannot complete the integration. According to the Nelson Mandela rules and minimum standards for social workers, we should be providing expanded opportunities. And in prisons, we have a lot of people with various diseases, and it could be half of the prison population which require healthcare services being escorted outside of the prisons to the hospitals located far away, and that's another challenge. You see, the handover has happened without full understanding of the conditions PHC. So with the teenage population, you see HIV, TB, everything is given to the PHC level. NGOs should be established to work together with the tertiary level and with the prisons. It should be separate in my understanding. And the fact that it is now the part of the general healthcare system, I believe this is not appropriate. I believe it's not correct as of now, but we would like to learn more from the international experience, because we are not ready, we are reluctant, and there is a strong integration of the social and healthcare work. And the GP, you think, would go to prisons where they have like 200 prisoners? Or, for example, one GP is assigned to the prison where they may have 2,000 prisoners. So it was not well analyzed step. Now we need to organize the civil health center to be a part of the health of the Ministry of Health rather than of the Ministry of Interior and Ministry of Justice, but it should be separate from the general PHC facilities. And now we have the influx of patients. And within the prisons, they have understaffing, and the staff is incompetent. Nurses don't treat properly. Yes, the handover is important, is needed, but not in the way it has been designed and happened.
You mentioned the important role of civil society organizations, and we know that in Kyrgyzstan they play an important role. Maybe our Kyrgyz colleagues can tell us how civil society organizations are working with the prison system. Maybe they can also say a few words of this NPM mechanism, how it is working in Kyrgyzstan, in contrast to Kazakhstan, just to have this comparison. Thank you.
Нет, я за Министерство здравоохранения и службу.
So I cannot speak on behalf of the Ministry of Health or the penal enforcement system, but we have the active interaction between the NGOs and the public health. And today Madina was the representative of the PVID community commenting as well, and they become a part of the monitoring exercise on a regular basis. For example, they monitor the healthcare product supplies in prisons also, and when we identify certain shortcomings, we discuss them at the coordination mechanism meetings to draw more attention to that. And as to your question, I would like to explain that in Kyrgyzstan there were few efforts made in the past in order to hand over the medical service of the penal enforcement system to the Ministry of Health, but because the main workload will increase the burden on PHC level. Therefore, because of these problems, it didn't happen yet. So such decision has been postponed. So for the medical unit of the penal enforcement system runs this function itself, but you see, yes, it's important to support humanization, but another problem that health professionals are reluctant to take posts within the penitentiary system. The infrastructure is severely underdeveloped in prisons, and there are no narrow specialists available in prisons, because when we did survey, everyone reported no dental services, no specialized services. That's why it's very important, like you said, to develop step-by-step strategy. You've started first, and you have a high probability to make the first breakthrough in progress.
Thank you very much for these very valuable contributions to the discussion, a very vivid slot. We've been here. Let me allow some concluding and some closing remarks. In each and every contribution, you mentioned a very important part. Ingo started with overcrowding. Luckily, all of our countries except China have a decreasing trend in the prison population. And only China slightly increasing. I don't know of India, but you might tell us. So that's a very good development, until the point that Kyrgyzstan has only 69 prisoners per 100,000 population. And that is incredible, the development in the last 20 years. And this development can be seen also in Kazakhstan and Uzbekistan, not to such a high degree, but 69 per 100,000 is global champion league, I would call it, because up till now, only Scandinavian countries had numbers like that. And that, of course, to empty our prisons and to give alternative methods of punishment, alternative punishments, community work, and many other things, electronic devices to check where people are, and many other modes of control can be installed instead of prison. I think that most of us would agree when I would say that prison is not the best school for the people. And if you talk about humanization, that includes that it is not human at the moment what's going up there. And there's lots of studies which show to the negative effect on the personality and health of people staying in prison for a long time. And we could empty prisons widely more. Ingo mentioned the Bangkok rules. When we take the Bangkok rules seriously, we can empty, for instance, the women prisons, because 80% of the prisoners, of the female prisoners, did not commit violent crimes. And if they didn't do so, there's no reason to incarcerate them. So we have got other forms of punishment, and we should install that. In almost every prison, and I know some of the Kyrgyz prisons, we see an absolutely overrepresentation of communicable and non-communicable diseases. And that means when we take the principle of equivalence, which is the guiding spirit of the and all the UN rules, Bangkok, Istanbul, Tokyo, and for, especially Nelson Mandela rules, if we do that take seriously, we have to provide the same quality, the same size of healthcare services that are applied in the community. This is being said in the Mandela rules, for instance, in the rule number 24, the first and second paragraph. A country which impresses me most is Kyrgyzstan. So I visited several prisons and I saw the whole range of services which we offer to drug addicts in the community, that goes from psychological and social work services, which has been mentioned by Bao Shan. Sorry if I don't speak it correctly, but this goes from psychological, educational service and support down to harm reduction services, including needle exchange, methadone treatment, condom provision, and naltrexone at the start of the release. And even now from Natalia, we heard, and from Julia earlier, peer-driven interventions and the strengthening of peer support with the inclusion of NGOs. And I think this is a standard which we do not have in most of the German prisons, for instance, that we have a range of services to let people choose what is the best in their situation, what can they do, where can they place their resources in order to improve the quality of their life. And we saw by Maria that a lot of people do continue with drug use while in prison. And she said more than 50% of prisoners do so, and half of them are injecting or consuming heroin. And I take every bet you give me that most of, or all of them, do heroin injection with non-sterile injection equipment. So the risk of the transmission of HIV and hepatitis C is immense in prison, and we should very clearly come to advocacy for harm reduction measures in prison, as well as for educational and psychological services, and in very strong integration of peers and NGOs from outside. Because we see that prison health is public health. That was the key spirit of the afternoon session this afternoon. And we have to advocate for that in order to get things done and to improve the quality of life. So, with having said that, once again, a warm hand for Ulla, who was the key editor of the publication, the book we launched just a minute ago. And books are only books. You can say it's only paper, but we can use them in order to argue for a better quality of healthcare and social services in prison. Many thanks, Ulla.
Yeah, thank you. And now we move on with our program to the next point. So a little switch, and our next people come in front. Okay, thank you very much for your attention. It was a great session with you.